Hello, everyone, and welcome to the podcast. Life is a story we tell ourselves. We are happy to have with us again Dr. Bruce Y. Lee, Professor of Public Health at the City University of New York. Dr. Lee, welcome back.
Thanks for having me again, Don.
Yeah, Dr. Lee joined us back in October of 2020 before there was an approved vaccine. I've asked Dr. Lee back, now that we have an approved vaccine, to ask him to help encourage people to get vaccinated who might still be reluctant by clearing up some of this misinformation surrounding the vaccines. So, Dr. Lee, why don't you tell our listeners why they should get vaccinated?
So vaccines in general have been one of the most effective and impactful public health interventions there have been, throughout history. Because if you think about it, the best way to really protect yourself and also protect the population is to provide something, which is a vaccine, that can prevent either you getting infected or you having bad outcomes from the virus. And so now there have been several vaccines, now 3 vaccines that are available around the world. The Moderna vaccine, the Pfizer-BioNTech vaccine, and also the AstraZeneca vaccines. And these vaccines, through clinical trials, have shown the ability to reduce your risk of getting COVID-19 with symptoms. So in other words, if you get the vaccine, you will be less likely to have COVID-19 and with symptoms and potentially severe symptoms that may lead to hospitalization, potentially death. So this is a big achievement to be able to get a vaccine like this. And so it's an important layer in the arsenal against the pandemic. These vaccines have gone through clinical trials, so we have results from them. So that's why their benefits are known.
So last time we talked a little bit about efficacy of a vaccine. So why don't you refresh our memory about efficacy? I mean, they've been saying that this vaccine is especially the Pfizer and Moderna vaccine are like 95% or more effective and have a really high efficacy. What does that mean exactly?
That basically means that they gave some of the study participants the vaccine, some of the study participants a placebo, so something that's not really a vaccine, and they compared, and they found that people were 90% less likely to get COVID-19 with symptoms if they got the vaccine versus not getting the vaccine. So that means, for instance, if you're exposed to the virus, you have 90% less chance of getting COVID-19 with symptoms. So that's quite significant because, people were aiming for 50% or better. They were like, oh, it'll be great if we can get something 50% or better. 90% or better is even much better. Now, of course, we know once that the vaccine gets rolled out of the population, it may not maintain at a 90% level, but this suggests that the protection will be fairly high.
Well, let's look at that a little bit further. So the people that got the vaccine, not the placebo, were they actually purposefully exposed to the virus in some controlled way, or were they just sent out into the general population and brought back in and tested later?
Yeah, just the general population, because way back when people would do studies in which they would deliberately expose people to viruses, but now that's not ethical to do. So, you don't want to put people in danger by deliberately exposing them to the virus. So what they did was they vaccinated, part of the study population. The other part got the placebo, and just over time, they went back to their sort of daily activities and their daily lives, and over matters of weeks and months, they were followed to see if they actually developed COVID-19. So that's really how the measurement is done. So it gives us a sense of what might happen over kind of regular exposure. So it's not deliberate exposure.
So were these people that were in these trials, were they encouraged to wear masks? Did they wear masks? Was other data taken to find out how they behaved in the general population?
That's a good question, because there's a variety of different risk levels. There's some people who won't wear masks or won't social distance, et cetera. So that wasn't really followed or measured in the study. Now, presumably, people who will enroll themselves or willing to enroll themselves in a vaccine study are probably more aware of COVID-19 and the potential risks. So they're probably more likely to practice social distancing and maybe wear face masks and things like that. But for that reason, for the fact that there's a fair amount of variability among people's behaviors, that's why the trials incorporated so many people. So we're talking about 30 to 40,000 people in these trials, because the people who organize the trials realize that there's going to be variability between people in terms of their risk for getting the virus. So they want to enroll so many people, like thousands upon thousands and thousands of people, so that in the end, you really kind of try to capture a wide range of different people.
Understand. So the people in the placebo group, did the data show that those that did not have the actual vaccine, they got infected at a higher rate? Is that correct?
It showed that they had a higher rate of COVID-19 with symptoms, so compared to the other. So that's the one thing that you may have heard floating out in the news, that it's not completely clear yet whether the vaccine will prevent infection, like getting infected by the virus. What the trials show is the vaccine seems to be effective in reducing your risk of developing COVID-19 with symptoms. Now, the question is, if you're vaccinated, could you still get infected with the virus? And could you still spread the virus without symptoms? That's not clear yet. That's why you're hearing the messages out there saying that, the vaccine can help you. It can help reduce your risk of COVID-19 and severe COVID-19, with symptoms. But don't assume yet that you can't get infected with the virus just because you've been vaccinated, because that hasn't been determined yet. Now we're waiting for more study data and trial data to emerge to give us a better sense. But that's an example of something that we still don't completely know the answer to yet.
Well, will there be, as more data is collected, will there be some point at which people who have been vaccinated will be notified, or the general public will be communicated with information that says, yes, you're safe now, you cannot get infected, and because we know more and we understand more, and so now that you've been vaccinated, you're fully protected, and you're not going to get the virus.
Yeah, absolutely. As this information emerges, then it will be communicated to the public. We have to remember that the pandemic really only started early 2020, and these vaccine trials, the phase 3 vaccine trials, really only started in July of 2020. So, things have been moving fairly quickly. And every time you get a trial result or a trial finding, it's been disseminated to the public. So that's why it may seem like things are evolving, just because things are moving so quickly. And every week, every month, we're getting more and more information about how these vaccines work in terms of, whether they can actually, what they can actually protect against. So that information should come out when it's available.
But the bottom line is there's enough information out there about the efficacy of the virus and its ability to prevent you from getting COVID-19 virus with symptoms to really warrant people getting vaccinations. It's important that they do that. Is that right?
Absolutely. So, biggest concern, the reason why this virus is such a threat is there is a risk of death. And even if you survive the virus, there are all these medical problems that you can have: respiratory failure, sepsis, organ failure. Many times people will have persistent symptoms way beyond the first few weeks. Here's situations in which people are having symptoms months and months after initially getting infected. So if you can reduce that risk, that's a big deal. Naturally, people want to live. People don't want to go through the hospitalization. People don't want to have those symptoms that can really affect your lives. So the vaccine, even if that's the only thing the vaccine can do, it's quite significant. So it is worthwhile having a vaccine, getting vaccinated to protect against those things.
Right. And so that's why I assume that you're still hearing public health officials and the medical profession communicating to people that even after they're vaccinated, at least for a time, they still need to practice social distancing, and that they still, of course, need to wear masks. But then people are very, leery sometime and saying, well, gee, why did I get vaccinated if my behavior is not going to change, and if I'm still going to feel very restricted in what I can do and not do? What do you say to those people? What's the answer to them?
Yeah, we have to remember that there's different layers to this this problem, this pandemic. One is, you want to still prevent infection, keep yourself from getting infected, because the vaccine seems to have a very high effectiveness in preventing severe COVID-19 or COVID-19 with symptoms, but nothing's 100%. So you can still potentially have issues even if you got the vaccine, but it does reduce the risk. And also, we don't know about whether it prevents you from carrying the virus and spreading it to others. So we have to remember that tackling the pandemic, there's not like one single magical solution. Vaccines are great and they can be very effective, but you still have to do a combination of things because the pandemic is a very complex problem. And so if you do multiple things to prevent the spread of the virus, it'll be a lot more effective in battling the pandemic. We have to remember there are no problems in anyone's lives to have a single solution. There's always a combination of solutions. So maintaining doing those different things is important. Yeah.
Understand. So what happens if not enough people get vaccinated?
Well, that's a key thing too, because we're all connected. So certainly, like if you get vaccinated, that can help prevent severe disease, but you also want to have a situation where you want to reduce the spread of the virus. And if the virus can prevent infection or somehow reduces the spread of the virus, then it really depends on how many people get vaccinated around you. Because as long as the virus can still find people to infect, then it remains a risk and it's circulating around you. And the more people around you that are infected, the greater your risk is. So the vaccine effectiveness really depends on not just the vaccine itself in your body, but like how much virus is circulating around you. I give the example of, is it effective to wear a t-shirt and shorts? Well, that might be effective in Hawaii or many tropical climates, but it's not as effective in Greenland or like the northern climates. So that shows you like the effectiveness of what you wear depends on, the risk of cold around you. So the same situation with the vaccine. The effectiveness of the vaccine depends on the risk of the virus circulating around you. So you want more people vaccinated so you can reduce the risk of the virus spreading around. So then in turn, you can have better protection for yourself.
But was that the same with the polio virus and the measles or rubella viruses, that same situation? You needed more people around you to be vaccinated in order for everyone to be protected?
Yeah, it's the same concept with any virus or any pathogen that can spread and transmit between different people, and if you have a vaccine. So the concept is herd immunity, meaning that we're all basically like in a herd. A group of people can be like considered a herd. And the more people that are immune or protected against a certain virus or pathogen, the less open parking spaces the virus has to park itself. So like if it can infect people around you, then the virus has more and more trouble spreading. So that's the whole concept of herd immunity. You want to increase your herd immunity, and you actually want to increase it above a threshold. Like if it gets high enough, like for instance, if 70 or 80% of the people can't be infected in a population, the virus will have a lot of trouble finding a new person to infect. And then ultimately the virus may just no longer be able to spread. And that's the goal.
Well, I think that's a little bit about what confuses people when you talk medically. You just gave a good explanation of what happens when you use a vaccine to get everybody to herd immunity. Mm-hmm. But maybe you should take a minute and explain the difference between what you're talking about there with herd immunity and what others talked about early on with the virus when they, claimed that we should just let the virus naturally spread. Forget about a vaccine. Forget about treating people. Just let everybody get sick, and eventually you'll get to herd immunity.
Yeah, so there may be a big difference between getting naturally infected with the virus and getting the vaccine. So the concern is if you get naturally infected with the virus, first of all, if you get naturally infected with the virus, there's a big risk. You may end up getting very sick, or you may end up being hospitalized or even dying. So it's not without its risk. So that's why, people were concerned, public health experts were concerned about, people were saying, oh, just allow people to get infected. Well, that means a lot more people are going to die, and a lot more people are going to be hospitalized and have bad problems. But on top of that, studies have suggested that if you get infected and then you recover, that immunity doesn't last forever, and it may actually not last very long. There's some estimates that it may only last about 3 to 4 months or even less. There's many cases in which people, well, not many, but there's been a number of cases in which people have been reinfected or may have been reinfected with the virus after they recovered. Mm-hmm. That's one of the reasons why the vaccine there's 2 doses. So basically, you get a dose of the vaccine to tell your immune system, it's called the prime dose, tell your immune system, hey, look out for this. And then the second dose, say, by the way, this is a reminder, it's the booster dose. So it's supposed to boost your immune response. So that protection is, in theory, supposed to be greater and last longer than just natural exposure. And we have to also remember, the vaccine is a little different from being exposed to the virus. The vaccine doesn't include the live virus. Mm-hmm. It basically includes what's called mRNA, which is like a blueprint. You give it to your body, and your body uses this blueprint to make a piece of the virus, just a piece, not the whole virus, something called the spike protein. So the virus looks like a spiky massage ball with little spikes on it. So it makes just those spikes. And then your immune system says, oh, these spikes don't belong in the body, and then generates an immune response specifically to those spikes. So anytime the immune system then will later see anything with those spikes, it will try to move to contain and attack whatever has those spikes. Mm-hmm. So the vaccine is more specific. It's saying, go against these specific spikes. So the immune protection may be stronger than natural infection because it's being very specific about that.
Right. So I don't want to get too much into the weeds medically, but does this vaccine include an adjuvant, which of course boosts the immune system, and is the reason why some people who have allergies are concerned about getting the vaccine? Is an adjuvant included in the vaccine complex?
It doesn't include a adjuvant. What it does includes a little encapsulation, like a coating, mm-hmm. that you keep the mRNA in. Like it's almost like a candy coating or something. I mean, it's not really candy, of course, mm-hmm. but it protects the mRNA until it gets into your body and immune systems gobble it up. So there is some suggestion that some component of that encapsulation may lead to allergic reactions. But if you look at the allergic reactions, the rate, it's been pretty low. So there's been many people have gotten the vaccination so far, and they found that the rate of severe allergic reaction is somewhere between like 2 and 10 or 12 per million doses administered. Mm-hmm. So, you do the math, that's a pretty low risk. Right. And even with the severe allergic reactions, they can be treated fairly quickly as long as it's recognized. And they tend to occur within the first 15 minutes of getting the vaccine. So far, there doesn't seem to be any significant safety concerns.
Right. And so you mentioned mRNA and how the virus works, and that should really help people understand, or how the vaccine works, excuse me. And that should really help people understand that you really can't catch the virus or become sick with COVID-19 by being vaccinated.
Yeah, it doesn't have the actual live virus in the vaccine. There's no live virus there. So there's no way that you can get COVID-19 from the actual vaccine.
Right. And when we say it doesn't have the live virus, that means that a virus is not going to enter the cells and then start to reproduce and then cause all of the, grave syndromes and symptoms that you get from a reproducing organism like a virus inside your cells. That mm-hmm. just happen.
Yep. Yep. Yeah. You really need the virus, and the virus has to be alive to get into your body to then start causing the problems that result in COVID-19. And the vaccine just doesn't have that. So yeah, you can't get COVID-19 from the vaccine.
Well, despite that, there's still a lot of false information out there on the internet. And I wanted to ask, should there be perhaps a more aggressive campaign to counter some of the false information being spread on social media about the vaccine? I mean, what are you public health officials doing? Are you advising Twitter and Facebook and governments on this subject to maybe counter the spread of some of this misinformation?
Yeah, it's really very important to pair up any type of public health measure, and especially a vaccine rollout, with a good communications plan. And the communications plan should be like experts and people who are really in the know talking about the vaccine so that everyone really understands the science behind it. The problem right now is we've got a lot of messages floating around, and it's not clear who is actually saying these things. So, in some of the messages, you'll see information, but you can't even figure out who's actually saying these things. Or in some cases, there might be someone making comments about the vaccine, but you either don't know what their background is, or if you look at their background, they don't have a scientific background. They don't have a medical background. They don't really have expertise in the area. So yeah, there have been some efforts among public health experts and medical experts to help the public better understand the science and the facts behind this. But it's really important when you get any type of message, you should look and say, okay, who actually sent me this message? Who's actually making this statement? What kind of facts are they using behind it? Because anyone can say anything, right? Like anyone can say anything on the internet, on Twitter, on the street, in a coffee shop. So you have to ask yourself, like, who's actually saying that information?
Well, I mean, you can't practice medicine without a license, yet there are scores of websites out there giving false information and misleading medical advice about the vaccine.
Yep.
When confronted, they respond that, they have a right to free speech. What do you say to those people, and what kind of responsibility does society have as a whole? I mean, you don't let somebody walk on an airline and say, "Oh, I'm a pilot. You have a license." "Oh, I don't have a license." "Well, what makes you think you can fly an airplane?" "Well, I read it on the internet that I should be able to fly an airplane." I mean, it's the same kind of thing. I mean, so what do you say to these people who say, "Well, free speech allows me to say whatever I want, whether it's true or not"?
Yeah, it is unfortunate because it has significant ramifications. So, you can talk about like a flower arrangement, or you can talk about like how to set up furniture, and maybe that may not affect people's lives, or might not lead to deaths or hospitalization or suffering. But if you sent out like information, medical information or public health advice, that can really affect people's lives. That can potentially even kill people. And so it's really, there needs to be more responsibility for what people are actually saying. Certainly, like, for instance, if a physician says something and that information is wrong, then the patient has the right to say, "Wait, you said wrong information." So, but that doesn't seem to apply to a lot of this information that is floating around. And also, the public needs to remember, like, would you take advice about basketball, for instance, if from someone who's never played basketball, or would you take advice from someone who on singing if that person can't sing? It's really important to make sure that whoever's giving the advice actually understands what they're doing and actually knows what he or she is doing. So that's a big problem or issue these days.
So even amongst the medical profession, people are being somewhat cautious about the vaccine and what it means for people. But in this caution, sometimes there's even confusion that amongst the public as to what is right and what's not. And we've touched on this a little bit about the long-term effectiveness of the vaccine, when you're actually going to know when you're fully protected. And so even these cautionary statements, which are very true medically, are causing some people reticence in wanting to get the vaccine. And so what do you say to those people who come back and say, well, gee, I'm not sure yet. And I'm even hearing amongst medical professionals that they're not sure exactly, what's going on with this vaccine. What do you communicate to those people?
Yeah, so I think one is, of course, it's an evolving situation, so we're getting more and more information as things evolve. I think one of the challenges is when the vaccines came out in 2020, there wasn't sort of a clear communications plan executed, by the federal government in the U.S. So there needed to be sort of clear communications plan so people can understand what we do know and do not know about the vaccine. So, what I mentioned previously is what we know about the vaccine. We know that it can reduce your risk of getting COVID-19 and especially severe symptoms or severe outcomes, which is really important. So that's very worthwhile getting the vaccine for that reason. What we don't know right now is, does it actually prevent you from getting infected or passing along the virus? And we don't know how long the vaccine will offer protection. Mm-hmm. But given that, and given the fact that there isn't yet a good alternative to the vaccine, that shows that it is worthwhile, especially if your risk of getting COVID-19 is fairly high. If you're a frontline worker, if you're a healthcare professional, if you're an older individual, et cetera. So that's what we know about the vaccine. And it's important, of course, to continue to follow information as it comes out. But the messaging needs to be clearer in terms of what you should do at each moment. So that's been an issue, but hopefully that will improve in coming weeks.
So one thing I wanted to bring some clarity to, so you can get vaccinated and your immune system can start boosting your immunity to the virus. But the one thing we don't know and that it can't do is that it can't prevent you from perhaps getting infected. In other words, being in a room with somebody, inhaling in the air and the virus is there, you get infected with the virus. But because you've been vaccinated, you're probably not going to get sick or as sick or sick at all because your immune system is already geared to fight the virus. And so what medical professionals are saying, when that happens, there's a chance still that you may be infectious yourself. You may be able to spread the virus. And the jury's still out on that, which is we still need to wear masks and do social distancing until that part of the data is clear. And I just wanted to make sure our listeners did that. That's correct, isn't it?
Yeah, that's correct. And also, the other thing is the vaccine is highly effective, but it's not 100%. So, there will be situations in which, you might be the unlucky one where, you're infected with the virus and you still develop severe symptoms. But your risk of that is a lot lower with the vaccine. So that's another reason why you want to maintain all those protections. Because the virus is still spreading so widely. That's the problem. So
I don't know if this is a prognostication question or a all-seeing eye question, but I'm going to ask it anyway. What's your prediction for the future here? Do you think we're going to see the light at the end of the tunnel with respect to COVID-19 and things will go back to normal? We'll eradicate COVID-19 like we did the measles or the mumps, or is it just going to be persistent in society like the flu is?
So, yeah, I mean, our current situation will not continue forever. And in fact, it's, the spread of the virus will probably decrease as the weather gets warmer and things get more humid. So then most likely during the summer, we'll see a lower level of transmission. It may pick up again in the fall and winter, but with the vaccine out and with the fact that the virus has spread quite significantly, that transmission may be less. So what will probably happen is, the virus won't be eradicated, meaning the virus will still be around. But, the question is, will it be around at really low levels, or we have a situation with the flu where it comes back, each year. But the big difference is once we have a vaccine against it, that really changes a lot of things because, like you get the flu vaccine each year. It might be a situation where you regularly have to get the COVID-19 vaccine. That's a manageable situation because, people do get the flu vaccine, and there are bad outcomes and deaths from the flu each year, but it's a lot lower. And those could actually be decreased even more if more people got the flu vaccine. So even if it's a situation where the virus is still around, the key is we don't want to be in a current situation where it's spreading so wildly. And, until now, we didn't really have any effective weapons against it. Yeah. So if we do have, that's why the vaccine is so important, because if the vaccine works and, you get enough people vaccinated, that will really change the course of the virus.
Well, you said the key thing there, if you get enough people vaccinated, and still the United States is lagging behind. I know we're just about out of time, but I do want to ask you one last question about getting enough people vaccinated. And that's you're there in New York. You're a professor of public health. You must interact with government officials there in New York. What could New York, a big city like that, and the state have done differently to get more people vaccinated?
Well, it was, the vaccine rollout was not very well organized at a national level. There wasn't enough discussions with everyone involved. The supply chain wasn't clearly evaluated and set. So the vaccine rollout has been fairly disorganized, starting December 2020. Right now, there's efforts by the new administration to try to fix that situation and to make it more organized and more coordinated. So hopefully that'll improve things, because there were many people who wanted the vaccine but couldn't get it.
Do you think Biden, the new administration, President Biden, and I only mention him because he said this, that he expected to get 100 million people vaccinated in his first 100 days. Do you think that's possible? That's a reasonable expectation?
It's possible. I mean, we'll have to see how much of these things can be fixed and, what problems will still persist and are more difficult to fix. The challenge, of course, is the Biden administration now has only had about a week to really look back at everything and see what, the issues may be. So, typically you need at least a couple of weeks to really figure out what's going on, if not longer. But it is encouraging that there's more talk about vaccine distribution now than there was in December or even before that. Because that suggests a significant improvement from what the situation was before.
Have you been able to get vaccinated?
Not yet. There's still a lot of folks who are in the first and foremost priority group, which are people who are regularly seeing patients with COVID-19 every day who still haven't gotten vaccinated. So, you really want to cover those folks first.
Right. I understand. Well, Dr. Lee, thank you for joining us. Again, I really appreciate you giving us so much of your time and clearing up some of this misinformation and encouraging people to get vaccinated. I want to mention to our listeners, we have on our podcast website an information page on the vaccine and vaccination. So you can go to lifeisastorypodcast.com/podcast, and you'll get a lot of information on that page about the vaccine. Thank you, Dr. Lee.
Thank you.
And we'll talk to you again soon.
All right. Thanks, Don.
Okay. Have a great day, sir.
All right. You too. Take care.
Thank you all for joining us for this episode of Life is a Story We Tell Ourselves. We have a new vaccination information page on our website, lifeisastorypodcast.com. Please check it out. It has great links to information from the Food and Drug Administration, the Centers for Disease Control, and the National Institutes of Health. And don't forget to subscribe to the podcast to receive regular updates. Join us for our next podcast on cybersecurity and learn what you can do to protect yourself from those dangerous and annoying hacks. Stay safe, share happiness, and remember, never stop questioning. Curiosity has its own reason for existing.